Hi, I'm Margrit Urbanek. I'm an associate professor in the Department of Medicine, Division of Endocrinology at Northwestern Medicine, and I studied genetics of polycystic ovary syndrome. We don't know what causes PCOS or polycystic ovary syndrome. What we know is that women with PCOS have high testosterone levels, that's the male sex steroid, and they have irregular periods, and they can also have ovarian abnormalities, which are picked up by ultrasound. Early and accurate diagnosis of PCOS is critical to women because since they have elevated testosterone levels and irregular periods, they are not ovulating as often, therefore they have difficulty getting pregnant. That is what people are generally aware of with PCOS. Along with those features of PCOS, women with PCOS are also at much higher risk of developing obesity, diabetes, and insulin resistance. And so even if women do not want treatment for their infertility, they should be monitored for those metabolic disturbances. Those are lifelong effects of PCOS, and they should be controlled as much as possible to avoid sequelae of diabetes that are very detrimental. So right now, as I said earlier on, is we don't know what causes PCOS, and it is the hope of geneticists studying PCOS, including our lab, to use genetics to determine what is the cause of PCOS. And once we know what the cause of PCOS, we can target treatment for that. And we can, when we look at the features of PCOS, we could postulate multiple different pathways by which we can get to those outcomes. And by studying genetics, we can determine which of those pathways are important. I personally believe multiple pathways are important, but in any one individual, one pathway would be the most important one. And so we would want to know that so we can treat that pathway. Is it metabolic, like insulin resistance, or is it hyperandrogenemia, high testosterone levels? Those would have different treatments, and we need to know what is going on in any one individual. I think the most critical thing is that PCOS is a syndrome. So as a syndrome, it's a constellation of different quote-unquote diseases, and any one woman will be quite different from another woman. So I think each woman needs to be studied and treated as an individual. There's not going to be one silver bullet that is going to treat all of PCOS.